Welcome to Monday Night Spark. We are doing a live stream every Monday, 8 o'clock. We'll be coming to you live to talk about all your health and wellness related questions. I am Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy. It is a mobile concierge PT practice here in Wallingford, Cheshire, Connecticut. Tonight's topic is going to be soft tissue care for runners. So last week I polled the audience. We talked about best exercises for runners to do. And tonight we're going to be talking about soft tissue care for runners. So if you are here, if you're coming in here live, type in live so I can see you're here. That will help me kind of shape the conversation. If I know some of the runners that are going to be jumping on today. And if you're here on the replay, just let me know you're here. And then I will be able to give you a shout out on the replay. So I'm really excited to be able to kind of do this live stream, really to generate a conversation, right? So let's make this kind of two ways. Last week, I really like how I kind of had some of the engagement, the conversation we had when I posted the topic in advance. A lot of you guys tuned in, joined the conversation, and I like to kind of teach in that format a little bit more. It's like when I'm working with one of my clients, we can have a conversation back and forth. So we got some people jumping on here. Tori, how are you? Rachel, thanks for joining. Stacy, good to see you. Shout out to you running your first half marathon. That is very, very exciting. You're going to do great. It's going to be an amazing experience. If you are an experienced runner on here, just put experienced. If you're a novice runner and you haven't run any races, you're looking to start running, or you just ran a couple of races, just put novice. That will also help me shape the conversation, see who else we can help out the most. So it is Marathon Monday, so it is a little fitting that we are talking running. I was thinking about all the runners today running the Boston Marathon. Obviously, the weather was not the greatest. Today was a really weird day in the Northeast. I know I went for a run at about 4:45, 5 a.m., and it was like thunderstorming, windy, rainy, and then I was driving to work and it was fine, and then it was pouring midday, and then the sun was out, and then it was raining again. It was just a really wacky day. I was just feeling for all those runners because I know in Boston it was, I'm sure, windy, and it was actually humid. So I heard the humidity was a game changer there. So for those that are jumping on now, how many of you have been there where humidity gets the best of you? Just type in humidity, right? We've all been there. You run a race and it winds up being humid and your time is just shot. Your time is just gone. I know I've been there many, many times at the New Haven Road Race because that one just classically loves to be a nice, hot, humid day. And you see like runners dropping like flies. So you know you're not going to get a PR on that day when it is humid. Rachel, thanks for jumping on. So if anyone has any specific questions regarding our topic today, just type them in the comment box and I will be happy to answer them. Lauren, thanks for jumping on. Casey, thanks for jumping on as well. So tonight's topic, the three things we're going to be talking about is what should you do as a runner to take care of your soft tissue? Also, we're going to talk about what does foam rolling do? And then we're going to talk about the common question I get with a lot of my clients, a lot of the runners that I come into contact with is, what should I do to stretch? All right, so why is this important? Why do we care about soft tissue? So when I'm referring to soft tissue, really referring to mainly, you can think about muscle, right? But also what connects the muscle to the bone is the tendon. So a lot of times, especially for runners, we can tend to get these overuse injuries, which wind up being soft tissue issues, either with the muscle or with the tendon. So like I'm sure a lot of people have heard about tendonitis, right? So we know it's kind of an overuse injury to the tendon, and there's a lot more discussion we get into tendonitis is, or is it a chronic tendinosis, a tendinopathy, we call it a problem with the tendon, but we know that it's the tendon has been overloaded and now it is painful. So that's kind of the soft tissue and why it's important to treat your soft tissue both kind of from a prehab standpoint, proactively, is to prevent a lot of these overuse soft tissue related injuries. The other thing is that we start to see muscle imbalances in a lot of runners I see who have pain. So you can have certain muscles that are tight and that are limiting mobility, and then you can have other muscles that are weak and they're not activating. So if those muscles aren't activating, then sometimes you got to inhibit the muscles that are too tight in order to activate the ones that you want to get. So classic example is going to be like the hip flexors. Usually is a pretty short muscle in most runners, right? Most runners are going to have tightness in the front of their hips. And then what muscle is going to be weak? Muscle on the opposite side, the glutes. So the glutes are going to be weak there. So that is kind of why it's important to take care of your soft tissue. Tiger, thanks for jumping on. So Rachel says she's in the process of rehabbing a patellar tendon. Wow, it is a slow moving process. Yes, it is. Unfortunately, patellar tendinopathy, patellar tendon pain and issues sometimes can take a long time to kind of recover from. And you have to have some patience. And depending upon how long you have had this problem, sometimes it takes weeks up to months to get better from that problem. So hopefully some of the talk that we are going to talk about today, Rachel, is going to help you out, because you really do need to address the soft tissue, specifically the quad muscles, in rehabbing the patellar tendon. So tightness in the hip flexors as well as the rectus muscle, which is one of your quad muscles, can also limit and put more stress on the actual tendon as it connects to the bone. So hopefully some of this will be helpful for you. Those of you, as an aside, I am super pumped. I just got this in the mail today. For those that are running the Cheshire Half Marathon, just type in Cheshire there. So I'm super pumped, not only to actually run this race, but because it is one of my favorite half marathons. But as you can see here, we got a nice little, our first race sponsorship for the Cheshire Half. So we got the little Spark logo there. So I was very excited to actually open this up in my mail today. To see that we are on the brochure. I am really, really getting excited for the event. We're going to have a Spark Physical Therapy booth. We're going to be giving away a lot of freebies. So definitely stop by the Spark Physical Therapy booth. We are going to be doing a runner performance giveaway. We're actually going to have two big grand prizes. The first of which is going to be a free running evaluation, one-on-one hour session with me, going through a specific running physical therapy evaluation, looking at your gait, looking at your running, looking at your kind of a total body strength, muscle length, stability evaluation. The other kind of grand prize basket is going to be this runner performance kit. So what I have in there is a $100 gift card to Woodbridge Running Company. So we know that changing your running shoes is very important. So I'm going to help you out there. We have t-shirts in there, we have socks, we have Body Glide, and we also are going to have a free 1-month exercise card, class card to Multi-Sports Academy in Hamden. They specialize in personal training, small group training classes to help keep you training in order to run. So that I'm very excited about. We're going to be offering those away at the Cheshire Road Race. So hopefully I will see you there. Please stop by, say hi. I would love to meet you. All right, so let's get into our first topic of what should you do to take care of your soft tissue. So a couple of things that we want to do, and one that I'm going to recommend is rolling. So rolling the muscles, whether you use a foam roller, you use a lacrosse ball, you use a tennis ball, you use a smash ball, whatever you want to use, definitely to kind of help, quote unquote, loosen up your soft tissue. There's a lot of kind of research coming out, and those that are kind of talking about proper soft tissue care. Does it actually loosen muscles? We probably don't think it loosens muscles, but what I could tell you is that if you do roll, you feel looser after you roll. And most of the runners that I work with will feel kind of restricted, looser. But what we do probably know, the probable explanation for this, is that we're stimulating your nervous system. So we're really kind of stimulating that nervous system in that area to calm things down a little bit. So your tissues aren't as kind of hypersensitive. And remember, our muscles are connected by fascia. So there's actually like connective tissue covering over your muscles. And what we think we're doing is we're stimulating some of the fascia, some of the nerves in there to kind of calm things down. So we feel like we're a little bit looser after we do some rolling. So definitely rolling. Meredith, good to see you on here. Thanks for jumping on. Rolling will definitely be an important thing to do. Other things that you could see a medical provider, physical therapist that will address soft tissue is either soft tissue mobilization, massage, right? You can see massage therapists who are great at treating the soft tissue. Also, you can use, like myself, I use instrument-assisted soft tissue mobilization, or the Graston technique. If you've heard of that, then we can treat soft tissue. And then the other tool that I like to utilize that will go deeper into the soft tissue, if you actually have specific trigger points within the muscle, within the soft tissue, is you could do some dry needling, or some who practice acupuncture, that will also treat some of the soft tissue as well. So those are some of the treatments that you can see for soft tissue. The other thing we can do for soft tissue is we can stretch and we can strengthen soft tissue. So both of those forms of exercise that you've heard of can help remodel the soft tissue. So the muscle, whether or not we want to remodel muscle to actually get it stronger, so increase strength, increase power. If we want to get hypertrophy of a muscle, so we want to make the muscle bigger, then we're going to add strengthening to get physiologic changes in that muscle. Dawn, thanks for jumping on. Good to see you. And the other thing besides strengthening is we can stretch a muscle, right? So there's all different types of stretching that we can do for muscles. So all of these kind of tools are things that you can do to address your soft tissue, which is only one of the pieces of the puzzle to staying healthy as a runner, believe it or not. So there are other things that you need to have good mechanics regarding your joint mobility. So if your joint mobility is restricted, for instance, let's take the example that I see commonly in a lot of runners I see is ankle mobility. Sometimes your ankle mobility can be restricted, and I'm not talking about the soft tissue, but the actual joint. So the joint, the bones that are connected in your ankle cannot slide and glide like they normally will, and you lack the ability to kind of roll over your ankle. And a lot of times you'll start to see this with hill running. So running uphill, you'll notice that your ankle is a little bit, quote unquote, locked up, or it will feel tight or stiff. The other thing is you might find that with going downstairs. So going downstairs, you will sometimes feel that little restriction in the front of the ankle. So then there's certain techniques that we can do for that, such as manipulation techniques, mobilization techniques, mobilization with movement techniques. So there's all these different kind of tools that we can utilize to help improve joint mobility. So does any of this make sense? If some of this makes sense, then just say "makes sense" in the comment box. And please kind of post in your questions down below. I will answer your questions. All right. So going back to Rachel's talk about patellar tendinopathy, one of the things I like to do, talking about some of the interventions I just talked about, is do some dry needling to trigger points in that quad muscle itself. Sometimes the outside part of the quad muscle, the vastus lateralis, can have some restrictions, trigger points, and I'll recommend dry needling that, doing some instrument-assisted soft tissue work to that muscle to actually take some strain off of that patellar tendon itself. And then you need to do some of the strengthening that we know can help patellar tendinopathy. So kind of loading that tendon with what we call eccentric strengthening. So like that slow lowering of specific muscles. There is kind of isometric holds in a squat position you can do for the patellar tendon, as well as like a decline squats. So decline squat board, so like standing on a board in the decline position will help load that patellar tendon a little bit more. So that can definitely be helpful for that. So we talked a little bit about foam rolling. If you foam roll, just type in foam roll. I just want to see how many people do actually do some foam rolling. So foam rolling, I would highly recommend that what you do with foam rolling is you don't want to spend 30 to 60 minutes foam rolling. Like foam rolling is not the workout, right? Foam rolling is not the training. Foam rolling is to stimulate that nervous system to kind of get you ready to move. So either before your runs or before your workouts. So before you're going to actually be lifting, then you want to think about that is the time you want to do your foam rolling. You should spend about 30 to 60 seconds rolling each of the muscles. All right, so 30 to 60 seconds rolling each of your muscles. That will definitely set you up for success. As we talked about it, we're probably stimulating the nervous system as opposed to truly lengthening muscles, or really, you're definitely not breaking up scar tissue. So you don't have like adhesions or scar tissue in your muscle. So if you've been told that, or if you're kind of afraid of that, please don't be afraid of that. You do not have any scar tissue or adhesions in your actual muscle. All right. The other thing I like to do with foam rolling is, number one, so like some general foam rolling tips for those who have not foam rolled before. Number one, you can get a foam roller literally anywhere now. So like Walmart, Target, any sporting goods store, obviously. They even have them at Five Below. So for $5, you can actually get a pretty high quality foam roller. You usually want to start out a little softer, just as you get used to it. Then as you get used to foam rolling, then you can go up in the densities to get a little bit more firm. And then you can start to get some of the knobs on it, some of the spikes. The rumble roller is my personal favorite. Then you can get into some of those. So that is foam rolling, definitely before your workouts or your runs. And then you can even do it after as well. So after your runs or workouts, that can be helpful to do a little foam rolling to kind of think about resetting some of your nervous system and resetting some of those muscles. So lastly, last topic I want to talk about today is stretching. So if you have any questions about stretching, let me know down in the comment box below. And if you're watching this on the replay, then I will definitely answer your question. So type in any question you have regarding stretching. But in general, what we want to think about doing is only active stretching before your runs, or dynamic stretching. So we're actually moving, and then passive stretching, or what we call static stretching, after your runs. So at the end of the workout. All right. I see this all too often. People are dead cold, have not run at all, and then they just get on the floor and start like stretching their hamstrings, going into a butterfly and holding it for 30 seconds. Your muscles are cold, they're not used to moving, and now you're trying to stretch something that is kind of cold and stiff. So think about more movement and kind of active motion, dynamic stretching, dynamic warm-up, movement prep before your runs, before your workouts. And then think about restoring that muscle back to its resting length after your workouts. So at the end of your workout, at the end of your run, that's when you want to stretch for a good 30 to 60 seconds. The research out there on stretching is variable on how long you should hold, how many times you should do it. But the majority of the research shows that the more consistent you are, the better the results. So the more frequent you can do it throughout the week, then that's going to give you a little bit more bang for your buck, if you will, as opposed to like one extremely hard session of stretching. Does that make sense? If that makes sense, type "makes sense" into the comment box below. I want to hear from you guys. If anyone has a friend who ran the Boston Marathon today, give them a shout out in that comment box. Boston, maybe one day, can be a pinnacle of my running career. But I hear it is extremely difficult course, hilly, especially the downhill, and the work on the quad muscles. So if you have a friend who did conquer Boston today, give them a shout out in the comment box so I could shout them out as well. So in this video, we talked about 3 common questions that I hear about soft tissue care for runners is, what should you do to take care of your soft tissue? We talked about different interventions you can get by a medical provider. We're going to talk most invasive first, dry needling, instrument-assisted soft tissue mobilization, massage, soft tissue mobilization. There are different massage techniques. We talked about self-care, foam rolling. So foam rolling is a great adjunct because you can needle yourself. I did try it once in my quad, and I was almost there to do in my quad. I couldn't go all the way though. It's really hard to separate out your hand from being your like PT hand, and then your body being your thigh, and saying like I'm jamming my muscle right now. So dry needling is hard to do on yourself. So if you can't do that, you can't kind of mobilize it yourself with some massage techniques, foam rolling is a great option. So it has been benefited many of the clients that I work with. So check out foam rolling. We talked about some of the mechanisms of foam rolling. If you guys want to hear more about foam rolling, type foam rolling in the comment box below, and I will put some specific foam rolling exercises together just for you. All right. So when should you stretch? We talked about that. Before, after, bottom line, before and after. Before, do active dynamic stretching, movement prep activities. After, do your static stretching, kind of the holding position. So if you found any of these topics helpful at all, if I helped you at all, gave you some value, then please hit that like and love button. That will help this video reach more of your running friends. Definitely share this out. If you have a running friend that this can benefit, or tag them, honestly, in the comment box below will probably be even better. So tag them on this post. I would greatly appreciate it. If you are a runner in the Wallingford, Cheshire, Connecticut area, and you are looking to stay happy, healthy, running, kind of love doing what you do, and you don't want to do it without pain or stopping running, so you don't want to go to a medical provider who's just going to say, well, you have pain, you're just running too much, so stop running. What we do here at Spark Physical Therapy is we keep you running without pain and doing the things that you love. So kind of modifying your running, your training plan in order to keep hitting that pavement, doing the things that you love. So if you think that you are a good fit for what we do, I would love to jump on a free consultation call with you. You can just put consult in the comment box below, or send me a private message or a DM on Instagram, and we can kind of talk and see if we are a good fit to work together. So this has been our first inaugural official Monday Night Spark. Every Monday night, we're going to be coming to you live on this live stream at 8 p.m. So I will get some topics to you. If you have any specific topics you would like to hear about, drop them in the comment box below. I'll be happy to put some content together for you to answer any of your questions. I hope you have a great week ahead of you, and I hope to see you guys at the Cheshire Half Marathon. Have a great night. Bye.